because I had already seen the hygienist and I'd spoken to her, I got in touch with her and I asked if I could go and shadow her just for a whole day as well. So she was working in another practice as well. So I went and shadowed her and she was amazing.
Welcome guys to another episode. Today we have Gamze Eroglu, who is a dental hygiene and therapy student. So it's going to be a bit different than usual, but we're going to get a lot out of this session. So thank you, Gamze, for joining us today.
No, thank you for having me.
So before we get into it, I just wanted to find out about, a little bit about yourself. So you are in Dundee at the moment. Is your family from Dundee? Tell us a little bit about yourself.
Yeah, so I live like in Arbroath, so it's just about 20 to 30 minutes from Dundee. My parents are originally Turkish, and but I was brought up in Edinburgh until I was about 4 or 5, and then we moved to Arbroath, and I've been there ever since.
All right. So what's Arbroath? Is Arbroath?
Yeah, Arbroath. Yeah. So
what's it like?
Do you know what? I love it. Like, it's a little seaside town, and it's always got good weather, and it's just got a nice vibe about it. Everyone kind of knows each other, so there's always a familiar face, like if you go down the town. Okay. So yeah, I do really like it here.
All right. So your schooling, most of it, was it done there?
Yeah. So I was went through primary school, and then we've got high school, and then I applied straight from my last year of high school to go do hygiene and therapy.
Okay. So tell us why hygiene and therapy, and what is hygiene and therapy?
So hygiene and therapy, I applied to, so there's Edinburgh, Highlands and Islands, Glasgow Caledonian and Dundee in Scotland who offer like the oral health science degree, and you're primarily treating like pediatric patients. You can do like temporary fill-ins, you can do some permanent fill-ins as well, and you can do, there's so much you can do that even when I was applying, I didn't realise how much more there was within the scope of practice until I was actually in the course. Yeah. I started off with, I knew I kind of wanted to go into like education and like really being with the public and like teaching. So it wasn't until my 4th year of high school, I actually done like a week of like shadowing at a primary school. And you know, I loved it, but I was just like, this isn't practical enough for me. Like, I was so creative and I loved art throughout school, so I was just like, just needed something more. And then I looked into dentistry, and I was like, yeah, I could actually see myself like doing this. And it was just getting work experience, I think, was like the most important thing, because I think it's easy enough saying you want to do it and researching it, but until you see it, it's either that light bulb moment, like, yeah, this is for me, or like, maybe this isn't for me.
And what was that like, trying to secure work experience? Because that's usually a tough one for many applicants.
Yeah, so I was quite lucky. I had asked my local my actual dentist if I could shadow like within the practice for a day. So when I went to shadow him, that was when I actually got more of an understanding of the whole dental team. So I shadowed the receptionist, I shadowed the hygienist there and the dentist, which was quite nice. Yeah. So that was my first time I got an understanding of the role of a hygienist, and like what a dental nurse does, how she assists, and the receptionist, the importance of their role as well. So that was really nice.
Did you ask to shadow each of them, or did someone suggest that you do that?
Yeah, so when I went in, the dentist, when he was on his break, like the hygienist was maybe seeing a patient, so I think he just kind of said, oh, do you want to go and shadow the hygienist? And then once I shadowed her, then it was kind of like, oh, just move around the practice, which was really nice. Yeah. So that was kind of my first time, and it was quite easy to get, because it's a smaller town here, but I do know from like my other dental friends that getting work experience can be really, really difficult, so I was quite fortunate. And then from that, I always kind of knew I wanted to do some kind of volunteering abroad, or so when I was 16, so I would have been in my 4th year, so I was doing our National 5, so it's like equivalent to GCSEs. They're not called gap medics anymore, they're called, I can't, their Instagram's different. I think it's like pre-global meds or something.
Okay.
So I went and done shadowing in Tanzania, in Africa. So that was another aspect of dentistry I got to see, which was amazing. So yeah, it was the fundraising for all that. And then, after those 2 kind of experiences, I was like, yeah, this is for me. Like, this is what I want to do.
So what are the next steps once you've done the work experience, as we're approaching that October deadline? What's happening for you?
So we had sat our exams, and my exam results didn't go quite as planned as I would have hoped to, which I think like is really difficult when you're in school as well. And the tutors and our guidance teachers were really good in supporting us, but I think it was, like I was saying earlier, it was kind of drilled into me, like, at that point, if you don't have the grades for dentistry, you can't get in, which now is not the case at all. And it was quite disheartening at that time as well, because I feel like if it's something you really want to do, then kind of having somebody close that door for you, it was a bit difficult.
Yeah.
So because I had already seen the hygienist and I'd spoken to her, I got in touch with her and I asked if I could go and shadow her just for a whole day as well. So she was working in another practice as well, so I went and shadowed her, and she was amazing. It was ticked all the boxes that I was looking for as well. Getting to do that kind of like through oral health education, and really getting that patient interaction still as well. So I was like, yeah, this is great. Like, so it was the October deadline was coming up, and I kind of had to make that decision. Do I go down the biomedical science route and kind of apply, or do I do hygiene and therapy and still have an amazing career? So I was like, right, okay, let's do hygiene and therapy.
Yeah.
So yeah, it was the application. So I was quite lucky when I applied, and you get 5 choices. So my 4 were for the hygiene and therapy schools in Scotland, and then my 5th choice I just put as biomedical sciences at Dundee as well as a backup.
Yeah. What were the entry requirements like?
I think I want to say 2 A's and 2 B's at Scottish Highers, but I know that's different to...
You're going to have to explain that to us.
A levels, yeah. So we've got, from my understanding, GCSEs are our national 5, so they're kind of your foundation grades, and then from that you sit your Scottish Highers in 5th and 6th year. So I don't know what years they are in England, because I know you have like year 11 and 12.
So we've got year 12 and year 13 for your A levels.
Yeah, so that'll be our 5th and 6th years of high school, so of secondary school. So I did really enjoy sciences, and I enjoyed like arty subjects. So I just picked the subjects I enjoyed. The requirements for Dundee, I'm sure, were 2 A's, 2 B's, and I think the only required subject was biology, I want to say.
Okay.
But they did require your national 5, so your GCSEs, to be like English, maths, and a couple of other ones. But each of the universities were different, but I don't think they differed significantly.
Do you have to do interview as well?
Yeah, so we have an interview process as well, which was quite... do you know what? I wasn't ever nervous for them, which was really, really strange. Like, I think like because I was still 17 at the time when I was applying, because I was a year younger for my year, but I was in the year above me. Okay. So I was like the youngest one in my year. So, and I wish I had the confidence I had at that age. Honestly, I felt like, yeah, I just was ready for the interviews, and I was quite lucky. So my biomedical science offer was my very first kind of any kind of UCAS update. So that was quite a nice wee little reassurance, like. And then what else? So then I got my Highlands and Islands interview, a Glasgow Caledonian and Dundee interview, but Edinburgh rejected me straight up.
Okay.
And from that, I asked for some more feedback because I wanted to know, okay, so the reasons for whatever they rejected me for, hopefully at my interviews for my other ones, I could use that if there was anything I just didn't include in my personal statement. So I think Edinburgh said that they were looking, I didn't play a sport or anything. I think Edinburgh were looking for someone who maybe done like an extracurricular sport and activity. So that was kind of like the only thing that they had said. And then I had my interview at Highlands and Islands, which were, so there were MMI style interviews at Highlands and Islands, and Dundee, and then Glasgow Caledonian was a panel interview.
Yeah.
So I had me and mum went up to Inverness the night before, and then it was fine. It was, you know what, it was the weirdest thing was I was the youngest person there, and everybody else was either a dental nurse or had some sort of like dental lab experience. So it was quite daunting being the youngest person there.
Yeah.
So yeah, it went well, I thought. So that was a nice wee confidence boost. And then I had my Glasgow Caledonian one shortly after, which was the panel interview. So that was different. So you're kind of like in a hallway, and there's like students to your other side, each side, and you're all waiting to like go into a room. And it was with like 2 tutors or staff from the dental school. Yeah, and they were really nice as well. I was honestly just willing to move anywhere.
How would somebody prepare for these interviews? What sort of questions are you being asked, and how do you prepare?
Yeah, do you know what, the one thing that I would say is the student rooms was an absolute godsend. Like, I read through every kind of dental or hygiene like kind of group, and I found like speaking to people who are in my year now, a lot of them were surprised by some of the stuff that they were asked in an interview. I think as what you put in is like what you'll get out of it. If you do your research and you really like look into it, don't overdo it as well. I wasn't one of these people who, like, me and my mum never sat, and I never got friends to like ask me questions, which I think some people find beneficial. But I think just being yourself is like the number one thing, and not to over prepare, because I think that could sometimes throw some people off.
Are there some obvious things that people should know when they're going for hygiene and therapy interviews?
Yeah, I think your reasoning why you want to do it as well. I think as well, a lot of dental students had put it as a backup, like hygiene and therapy as like their 5th choice. And I remember reading on Glasgow's, like, someone had just wrote something saying like you'd get a straight up rejection from Glasgow, because they want students who are really wanting to obviously do hygiene and therapy. So once I'd kind of made that decision, you need to just know your reasons why you want to do it. What qualities you have that really is going to make you flourish within that career. I remember just looking on every website what they wanted. So like, they want someone compassionate, caring, good communication skills. And then I wrote another list of stuff I had done, and I had just matched up stuff I had done with really what they're looking for. And kind of in my head had like a structure of, okay, well, if they ask me anything about, so what makes you empathetic, then I would have an example to back them up, because it's easy enough for anyone to say, I'm lovely, I'm kind, I'm caring, I'll be great. So is the next person that's going to be sitting in that chair is going to say the exact same thing. So you need to really just say what's going to make you stand out and have a backup example of that. So yeah, that would be kind of my like number one tips, is know what they're looking for. What have you done to show them that you're the ideal candidate for that? and yeah, just be confident in yourself. I think it is scary, it is daunting, but I think confidence is definitely key. And if you're not a confident person, just pretend, like just put on a front. Like the people who are sitting in front of you are going to really take more if you are a calm speaker than if you're nervous, and which is normal, but you'd rather show them the good. You've got what, a couple of minutes in MMIs really for each station. So I think I actually preferred like panel interview style, because I really felt like the people sitting across from me after the 30 minutes got an understanding of me. But then there's pros and cons, because in MMIs, if you mess up on one station, it's not the end of the world. Like I remember thinking in Dundee, that was my worst one, because I think I'd put so much pressure on myself, like I really want this one. And I'd put so much pressure that as soon as I came out of it, I was like, oh, that's it. Like I'm not getting into Dundee. It's so competitive as well. Like I think, well, in our year, there's only 9 students.
Okay.
Yeah, Highlands and Islands, I think, take 14 each year. And they're split up over 3 campuses. So Stornoway campus, Inverness campus, and they've got a Dumfries campus. I think Glasgow take about 14, 15 each year as well. And Edinburgh take about 10 as well. So spaces are really competitive for the course, which I never even knew, which was probably a blessing, because I think it would have stressed me out more. Yeah, so that was another kind of thing afterwards. I was like, there's very little spaces for the amount of people that do apply for it.
Yeah. So tell me, in terms of, okay, so dental hygiene and therapy. So break that down for somebody who has never heard that term or that job role title before. What is dental hygiene and therapy?
Okay, so and like I think until really not recently, but a hygienist's role I think is understood a bit better. So your main focus is on periodontal disease. So your scale and polishes, that's kind of like your hygienist is like the prevention. And then the therapist's role, that's only recently came into place, like a dual, maybe 20 years or so, I want to say. And they're kind of, you can do your pediatric stuff, you can do it's more your restorative aspect of it. Yeah. So in first year, we kind of do all the perio stuff. So that's all your hygienist kind of stuff. And then in second year, you do more of your restorative, and that's your like therapy stuff. And that's in third year, it kind of all comes together when you do your pediatric modules, which we'll be doing next year. Well, this coming year.
With the hygiene part, that's more prevention, education, dental cleans, that sort of thing.
Yeah.
As the therapy, you're now doing things like fillings and a bit more treatment.
Yeah, so a therapist does all the roles of a hygienist with the additional of your kind of fillings. But yeah, it's do you know what, it's been great. It's been really, really good. I've loved it. The patient aspect of it is amazing. And see, we got really early patient aspect, like experience, like in Dundee. So I think we started in September, and if you passed your Christmas exams, you were seeing patients in January.
All right.
So it's really, really quick, all the theories, because it's 3 years. So yeah, it's very quick, but it's good fun.
It seems like you have small year groups. What does that mean? Does that mean that you get to make friends quicker? Does that mean you get more attention with your clinics and lectures? What does it mean to be in a small group?
Yeah, so our year, so there's 9 of us, and we're split into 2 clinical groups. So my group's a group of 4, and the other group is a group of 5. So there's 1 to every 4, and sometimes even you get 2 tutors on clinics with you as well. So it's really 1-to-1, which is really nice when you're first starting, because it can be really scary. Yeah. It's quite like overwhelming as well in a way, but no, it's really, really nice how 1-to-1 it is, and you really get like close with your year as well. So it's a nice mix, and it's good because I know some people are in obviously bigger years, and different courses have like 200 people that you might see a new face every single day, even in your last day of fourth year, whereas no, you really get close with your year.
Do you get to mix in with students from other courses?
Yeah, so we're with the dental students who are, so in first year you're with the third year, so they're kind of the 2 years. Yeah, you do your CMS module, which is a clinical medical sciences module. So that's kind of like different diseases and like oral cancers and medications that can have an effect so on like your teeth. So yeah, you do mix with the dental students quite a lot, but we're the last of our curriculum, so it's just changed for hygiene therapy this year, well last year, and they're in the new like year groups are all integrated from day one. So which I think is really, really important, because a lot of dentists, unless they've got a hygienist or therapist in the practice, still don't really have an understanding really of the full scope of practice. So it's really nice having that integration early on, I think, because you sit side by side and you learn about each other's scope of practice, and I think that would really help like once qualified as well.
So talk to us about that. How does that relationship work between dentists and therapists?
Yeah, so I have loads of dental student pals, and it is really nice, and they're learning as much as we're learning about their role as well. So you have like dental ball together, halfway ball together. You have a lot more integration has now started to happen, which I think it didn't really before. So I think it's just trying to close that gap and really having an understanding of each other's roles.
And then when you're actually working within a practice, how would the dentist and the therapist work together? Give us an idea about that.
So you would be working really, and so we do you can apply to do a VT year as well. So a lot of the time the hygienists and therapists can get referrals, but you can see your own patients like through direct access as well. So you would need to, I think it's for local anaesthetic, you need to get a prescription. So we're not allowed to prescribe, but we're allowed to carry out like local anaesthetic. So if you need a prescription from a dentist, then it would be a case of obviously discussing the case. Similarly, like on clinics, you kind of learn to do that. So once you graduate, you have an understanding. So it would just be, so our tutors would ask one of the dental tutors to come over. We would kind of present the case, why we need that local anaesthetic, kind of what side effects it could have, if any. So yeah, it's good to start that early on, I think.
Yeah, awesome. And then, so the 3 years, you get clinical exposure really early on within first year. How do things develop in second year and third year?
So yeah, first year you get all your perio, so that's your scaling, your charting, you do kind of all that aspect from January onwards, and then when you come back in September to go into second year, from September to December, you're in the clinical practice like phantom heads, so you're practicing all your restorative stuff, so your rubber dam, your fillings, all that kind of stuff. And then but you sit an exam at Christmas before you go away for the Christmas holidays, and then if you've passed that, then in January you're seeing all your kind of first year patients, but then you've got the additional second year stuff like your fillings. But unfortunately that was kind of cut short for us this year. So yeah, we're kind of lacking as much second year experience as we would have liked, but when we're going in up from next month onwards, we've kind of got that allocated time to just really reskill again, practice, because like everyone, it's been a long time off, and especially when we were just kind of getting the hang of things, it just all had to stop. So yeah.
And you alluded to it earlier, you have a foundation year, a VT year. So how do you apply for that? Do you apply for that during your third year? And how does that go?
Yeah, so next year we'll be applying for, I think there's something like 15 spaces for like the whole of Scotland. So it's, I think obviously with the dental students, it's compulsory that you do a VT or a DF, what is it, a DFT?
Dental foundation, yeah.
Yeah. So yeah, you need to apply through the uni help you with all that as well. I think somebody comes in and kind of gives you a talk about it, how you apply online. Then you need to go through like an interview process. So you get a list of the practices, and then you put your practices that you would want to go to in order, and then you go to interviews, and then the practices put the people they've interviewed in order, and then you get matched up like that. But yeah, spaces are so limited for that as well. And if there's around 30 graduates each year for the whole of Scotland, not everybody does get a space for it. So we'll be getting to do that. We'll start applying for that next year.
And do you get the option to apply out of Scotland?
Yeah, I think you can apply. I think England have a similar one. But I haven't looked into that as much, so I'm not quite sure how that. I would imagine it would be kind of similar.
Okay, so you would get the option to enter into the England recruitment process if you wanted to. You're not limited to the Scotland.
I don't think you're limited just to the Scotland one. I think you can apply to the English ones as well, but I'm not 100% sure.
I saw that you wrote an article recently, the link between perio and COVID. So how did that come about? And, are you interested in that sort of thing, writing articles and research? Or?
Yeah, so I always really enjoyed like kind of creative writing, and since kind of making my Instagram page, it was Dentistry Online who contacted me through my Instagram and asked if I would be quite happy to write an article, and I was obviously more than happy to do it. So then we kind of discussed topics, and we thought like it would be great to write something in relation to COVID, what effect it's going to really have, and so yeah, it was really good fun writing it. It was nice kind of speaking to different people about how they've been affected, and just really like gaining an understanding. I think dentistry's never fully like stopped until this year. Well, even with the HIV and everything, like dentistry was still continued, but it was more like under cautious. But yeah, so it's been interesting.
Yeah, and you're also a member of the BSP, British Society of Periodontology. So do you actively look to get involved with different organizations? Is that something that you're passionate about? Tell us about that.
Yeah, so the BSP, we'd got an email through our university, and they were looking for a couple of students to join from Dundee, and you had to send away an application, and then tutors selected 3 students. So I was really pleased to be like selected as one of the other. Well, there was 3 of us in total from Dundee. So that was really good, and we've done so much through that as well. We've done a webinar, and yeah, my one thing, I think starting when like in first year, it was quite overwhelming with like how much is going on, and then you really start to settle and find your feet. And then I'm always keen to kind of get involved with stuff, and if anything kind of comes up, I'm like, give it a shot. Like you need to really take advantage of these experiences that you do get the opportunity to have through universities. And I've made so many friends from it as well, and it is really good fun. So that's kind of one thing I would say to anyone applying or like is in university, just put yourself out there. The worst thing that's going to happen if it doesn't work out, you've tried, and you've got more opportunities from trying than if you don't.
That's true. I like that. So, okay, as we come to a close, what would you say dentistry is to you?
I would say it's challenging, it's fun, and for me personally, when I'm on clinic, I never feel like, oh, like another day on clinic. Obviously you have tougher days, but I am so thankful that this is what's going to be my career. Like, I'm going to be getting to do this for the rest of my life, and I don't feel sad about that. Like, I'm excited and I look forward to it as well. And I think, yeah, just you need to put your heart in it, definitely.
Yeah. And where can people find you if they want to get in touch, ask you some questions, get some advice? How can people find you?
So I'm on Instagram, and my Instagram name's the Dental Therapy Student. And like I've said so I get so happy when people message me and ask me like how I found the application process, to read personal statements. I'm more than happy to do as well. Because I think like what I wish I had going through the whole process, I'm more than happy to do for anyone as well that's really at that early stages.
Awesome. No, thank you, Gamzee, for coming on today, and looking forward to what you'll be doing in the future. So yeah, thank you for coming on.
Thank you so much again.
All right, guys, make sure to follow Gamzee on Instagram. I'll put the details in the description. Make sure to subscribe and watch the other videos that we're going to be putting together for aspiring dentists. And now we've got something for dental hygiene and therapists as well. So make sure to be subscribing.
If you're thinking about studying dentistry, whether you're in college or whether you're in a degree right now, I think just have a chat with them, and they will help you from start to finish.